Just want to remind everyone that I've just started recording. So if you don't want to have your face on our YouTube channel tomorrow and into perpetuity, you might want to turn your camera off now, but you're also totally welcome to leave it. My name is Ruth Kapelis, and I'm the National Content and Media Relations Manager. And on behalf of Breakthrough T1D, I'd like to welcome you tonight to our Breakthrough T1D educational series. We're very excited to present with you more information on advocacy and type 1 diabetes. If this is your first time coming, welcome. If you've been here before, welcome back. Just to give you a little bit of information about Breakthrough T1D, we are a global leader working towards free from type 1 diabetes through research, funding, and of course, advocacy, which we will be talking about more tonight. We support people and families in the T1D community from the time of diagnosis by helping those living with T1D to have better, healthier, and safer lives while working to find cures. We support anyone with T1D at any stage or any age, including the often underrepresented adult community. Before we begin our formal presentation, I'd like to respectfully acknowledge that the Breakthrough T1D Canada National Support Office is located on the traditional lands of the Mississaugas of the Credit, the Anishinaabe, the Chippewa, and the Haudenosaunee and the Wendat peoples. The education series offers information on a new topic every other month or monthly, and we will be having 2 more events this year in October and November. October will be T1D and your finances, and November will be a clinician perspective on diabetes devices, including automated insulin delivery systems and adjunct therapies like GLP-1s. So we hope that you can join us for both of those. We also host a virtual connection series on the 4th Wednesday of each month. This is an unstructured opportunity to connect with others in the T1D community with no formal programming. We just had one yesterday, so the next connection series will be taking place Wednesday, October 22nd at 12 p.m. Pacific time and 7 p.m. Eastern time. So just a couple of notes. We are a fairly big group, so we just want to minimize the background noise and we'll have everyone on mute. And there is a raise hand button, so if you need clarification during the presentation, you're welcome to raise your hand. But we also have a chat function and encourage any questions to be commented on in the chat. And we'll try to get through all of them tonight, time permitted. The session will also be recorded and we'll be sharing with you tomorrow. Breakthrough T1D brings people together affected by T1D who want their voices heard. We advocate together with the T1D community to members of parliament, as well as provincial and municipal elected representatives. These relationships strengthen our community, provide support, and deliver our message: the need to accelerate research and improve access through funding from both our federal and provincial governments. Tonight, we'll be talking a little bit more about the National Pharmacare Program, our Access for All program, and about how Breakthrough T1D advocates together with the T1D community for greater device coverage across Canada to reduce out-of-pocket expenses and improve access to diabetes technologies, and advocacy opportunities that you can participate in and advocating at all levels of government to help work with us to improve outcomes for people living with this disease. And it is now my pleasure to introduce our speaker tonight, Joey Wong. Joey Wong serves the Government Relations and Advocacy Officer at Breakthrough T1D. Since joining the organization in 2022, Joey has worked alongside the T1D community to advocate federal, provincial, and municipal governments in raising awareness of life with T1D, securing funding for T1D research, expanding public coverage for diabetes technologies and devices, and strengthening government support for all Canadians affected by this disease. Through his work, Joey is responsible for planning advocacy programs like Kids for a Cure, Advocacy in Action, and online letter writing campaigns. Prior to joining Breakthrough T1D, Joey worked in federal politics, supporting members of parliament both in Toronto and in Ottawa, and has successfully managed political election campaigns. We feel very fortunate to have him here working with us. So Joey, I will now turn it over to you.
Thanks, Ruth, and hi, everyone. Thank you so much for taking the time, wherever you may be, to join us today to talk about T1D and advocacy. As Ruth mentioned, my name is Joey Wong, and I'm the National Government Relations Advocacy Officer here at Breakthrough. and I've been with the organization for over 3 years now. Before I begin, I'd just like to take a quick survey with you all. And you can use the raise hand function or react with the smiley face or thumbs up. But a show of hands, how many of you have advocated before, either by yourself, with others, or with Breakthrough T1D? Awesome. All right. So we have some seasoned advocates in the room. Thank you. And how many of you are brand new to advocacy or have never advocated before? Okay, so a few of us. All right, thank you. Well, thanks for joining us. Regardless of your experience with advocacy, we're very happy to have you here. Today, I'll be giving a brief overview of all things advocacy here at Breakthrough T1D, including what it is, how we do it, some of the progress we've made through advocacy, and like Ruth mentioned, some ongoing advocacy priorities and opportunities for you to participate in. So with that, I will be sharing my screen here. Technology works. Okay, so what is advocacy? Advocacy, very simply put, is speaking up, supporting a cause, taking action, or encouraging others to take action with the goal of making positive change. Now, that's a very simple definition, but the point I want to make is that advocacy can be very simple. If someone with no prior knowledge of T1D asks you about the disease, and you educate them and raise their awareness, that lends itself to advocacy. So for those of you who said they haven't advocated before, under this definition, you may have been advocating already without even knowing. Now, in the case of Breakthrough T1D, our goal is to, of course, find a cure and make every day better for the people living with the disease. And this work is supported by our advocacy, and we work with T1D communities across Canada to advocate politicians at federal, provincial, and even at the municipal level. Again, to raise their awareness, help them understand what life is like living with the disease and what they can do to help. Now, Breakthrough T1D advocates, they are diverse and they all bring to the table their unique experiences. They can come from any age, background, or culture, and we have advocates from across the country. Very lucky to have them. What they do all have in common is that they've all been impacted by T1D, either through living with it themselves or knowing someone or having a loved one who has it. Oh, is my screen showing for everyone? Okay. Sorry about that. Maybe someone can help sim their technical issues. But sorry, what I've mentioned earlier, they've all been impacted by T1D themselves or through someone they know. And again, they are passionate about sharing their stories and using it to benefit others. So, for example, I've highlighted a few of our advocates here in this slide. First of which is Vanessa, one of our young and outstanding advocates. She was diagnosed at 13 months old, and she's been deeply involved in volunteering and advocating with Breakthrough T1D her entire life. Besides fundraising for walks and awareness campaigns, she was also an advocate as part of Kids for a Cure, which I'll get into shortly. And she loved it so much that she volunteered to mentor the next generation of delegates in 2024 and was the most recent recipient of our organization's Volunteer of the Year. Next, we have Mary and Monica. They both live in the same neighborhood in Toronto, and they both signed up to participate in one of our advocacy campaigns. Through this campaign, they were connected with each other and quickly bonded after finding out that they had lots in common. So rather than reaching out to their member of parliament separately, they combined their voices and experiences together to leave a more impactful impression during the meeting. And there you see them pictured with their former MP, Marco Mendicino. So this is a great example of how advocacy often relies on bringing people together to present a more compelling case. And lastly, we have Matt. Matt Ferry, some of you may know, sits on our board and also on the international board. And despite not living with T1D himself or having a personal connection, he has formed deep connections with the community ever since he first learned of our organization and from meeting and hearing from families impacted by the disease. So this year at age 61, Matt had the ambitious mission of cycling over 7,400 kilometers in 61 days across Canada to raise funds in support of T1D research. Now, yes, this is an amazing fundraising achievement, but in the process, he also advocated for the community by raising awareness at every stop and through media attention, of course. So this is a great example of, despite not having a personal experience or connection, you can still be a voice for change, and also how you can advocate, not just with words, but also with your actions. So how we advocate, primarily there are three ways in which we advocate, each with their own strengths and weaknesses, with its own time and place, serving different purposes, and sometimes in combination with each other. First, there are meetings, which everyone knows, very common. Advocating through meetings is a great way to get our ideas across the table and brings about change. Whether it be one-on-one or as part of a group, it can be formal or informal, virtual or in person. We meet with policymakers at every level all the time as part of our advocacy work. Meetings give us an opportunity to put a human face to the issue and often leave a more personal and lasting memory with those we meet with. And finally, it also helps us establish and build relationships that we need and rely on in order for us to work towards our goals. Next up, we have events. We also advocate through hosting or participating in them to engage with members of the public or with policymakers. This includes things like our annual walk and ride events that are held in a very public location, helping to create awareness and inviting people to ask more questions and to learn more. We also host closed and invited events like breakfasts in Ottawa, where we invite MPs and senators to learn more about the developments in T1D research. And it also provides an opportunity for them to meet with the people working directly on the research and the families and the individuals who benefit from them. And finally, we have online actions. Mostly, they take the form of online letter writing campaigns, where advocates simply input their information like their name and address into a form, and an email will automatically be generated and sent to their local representative. Now, unlike private meetings, which allows for more nuance and more back and forth, this is essentially the opposite. It's one way and very direct. This type of advocacy also favors quantity over quality, and it gives us an opportunity to showcase the T1D community as a very active and vocal and unified one. While this requires the least amount of efforts from advocates, it's very effective. It amplifies the community's voice, like I mentioned, on a single issue. And the more people who participate, the more effective and more compelling that message is. This method demands the attention of the intended audience and is particularly helpful when our initial message is not getting across or is not being acknowledged. So those are primarily the three methods we employ, and you'll see examples later on of when and how we use them. Which brings us here, change through advocacy. Some examples of positive change that we've been able to achieve through our advocacy work. First of which is the Breakthrough T1D and CIHR partnership. CIHR is the Canadian Institutes of Health Research, and they are the federal government funding agency for health research in our country. So for this reason alone, it's paramount that we develop a really good relationship with them. And we did so through continuous advocacy. Eventually, we were successful in cultivating this relationship based on a shared vision of improving care, treatment, outcomes, and cures for those living with T1D. And this enabled funding of $30 million in 2017 and renewed for $7 million in 2021 to support clinical trials and translational research. So this unique partnership ensures that T1D remains a priority for the federal government and in the landscape of Canadian health research. Secondly, in Alberta, in 2022, the government there had this idea of ending the program to provide public coverage of insulin pumps and supplies. This came as a shock to many since there was no indication that the government was heading towards this direction, and there was no consultation prior for them to announce this. So as you can imagine, this was not welcome news, and many were alarmed by the potential loss of coverage. So the community and lots of individuals reached out to us, Breakthrough, and also publicly to their representatives to voice their dismay at this decision. So what we did, we added our voice to the communities. Through our channels, we reached out to Alberta's health minister, urging them to reverse course on this, and eventually they did a few months later. Recognizing that improvements were needed to better understand the needs of the community, they also created a diabetes working group consisting of stakeholders, healthcare providers, patient groups, patient advocacy groups like us, all to help them better understand and inform them before making any decisions on diabetes in the future. And since then, they've listened to our recommendations, and they did improve coverage for devices like insulin pumps and CGMs for all ages. And lastly, disability tax credits. Also in 2022, the disability tax credit was changed to allow any individual diagnosed with T1D to automatically qualify for the credit. Now, prior to this change, people needed to provide a list of their activities, detailing by the hour and how many hours they spent per week administering life-sustaining therapy. This was very arbitrary and restrictive in a criteria, and it makes no sense in the context of someone living with T1D, since they make countless decisions every day based on the disease, and they're constantly reminded to do so. They also benefit from the life-sustaining therapy, but since there's no cure currently, that number isn't expected to change. So what we did is we launched an online letter writing campaign, and eventually were able to get this change for the community. And lastly, here, pictured here is Sonia Sidhu, the MP for Brampton South. She's the type of person we would be advocating to, and in her case, she has taken up the role as a champion, and in turn has become an advocate for the community herself. Her advocacy came in the form of a bill that prompted the government to develop a framework designed to support improved access to diabetes prevention, treatment to ensure better health outcomes for Canadians, and it also sets a common policy direction for federal and provincial territorial governments to follow in addressing diabetes, and also seeks to reduce gaps and duplication and effort in improving access and treatment. So this was a first of its kind and a very exciting step in the right direction. Now we're on to some ongoing advocacy work, some of which may be of interest to you, and some of which you might be able to participate in, actually. First of which, I wanted to highlight National Pharmacare. This was a very exciting announcement, very surprising, but at the same time, not without its problems. We were excited to have diabetes medication as part of its first initial phase of covered products. And we were very enthused by the idea of a fund for diabetes devices also. But at the same time, we were also very concerned about the list of insulins that they introduced, just because it wasn't very comprehensive. And this was something that we heard from the community very loudly. from healthcare providers, from endocrinologists. And it's something that we brought back with us when we advocated both privately with the health minister's office and publicly when our president and CEO testified at the health committee. So currently, we have, or rather the federal government has signed health agreements, pharmacare agreements with three provinces and territories, or sorry, three provinces and one territory, some of which has started coverage already. So you have Yukon, BC in the west, Manitoba, and not to be left out, Prince Edward Island out in the east. Now, others have indicated their interest in signing on as well, like New Brunswick. But as far as we can tell, they need to have those initial discussions first behind the scenes. And there are incentives for provinces to do this. In those four provinces and territories, national pharmacare either improved or expanded coverage. And where there was existing coverage, that federal funding frees up room for other parts of that province's healthcare budget. So where we stand right now, this is what we've heard just earlier this month, actually. Minister Michelle said everything's still on the table, and they're waiting to see how the existing agreements play out before making a decision there. And despite being relatively quiet on this issue before, Prime Minister Carney stated his commitment to keeping it and achieving agreements with the outstanding provinces who haven't signed on yet. But that looks like it's happening later rather than sooner. But until then, we still continue to engage with the federal government on a number of issues, including national pharmacare. And we'll continue to seek clarity on additional agreements, including any updates on that devices fund that they keep mentioning. Next is Kids for a Cure. Kids for a Cure is our signature advocacy event, which takes place once every 2 years during the month of November, National Diabetes Awareness Month, with the next one taking place just next year in 2026. Kids for a Cure brings youth advocates from across Canada to help politicians better understand the challenges of living with the disease and how important it is to them that we find a cure. It takes place over the course of 2 days in Ottawa, and youth advocates, along with one guardian, we bring them all together in Ottawa to meet with MPs and senators, again, to help them raise awareness of T1D, share their experiences, and advocate for cures research. It is an incredibly popular event. Every other year, over 100 applications, or we receive over 100 applications. And in 2024, 18 young delegates were selected between the ages of 6 and 18. They had over 50 meetings, including a reception and also visits to the House of Commons and Senate during their question period. This event, it allows our organization to raise awareness, like I mentioned, while building relationships with those within government and advocate our priorities. For our young delegates, not only do they get the chance to tour the Capitol, it's an opportunity for them to develop advocacy and speaking skills, watch democracy take place in action. They also form lifelong bonds and memories with others just like them. For the parents who are there with them, they also meet others just like them. And I've seen them swap stories about their kids or talk about the devices or AID systems they use and have experience with. And for me, from having the privilege of being to 2 Kids for a Cure events, I've personally seen what a special event it is. The hotel we stay at is not exactly a small one, but during their free time, the kids really take over and have so much fun with each other, either running through the halls or playing the pool. Just one example, like a device would beep in the room and either no one would bat an eye or they would all try to guess who it is and be there to support each other. I've seen older kids look after the younger ones, not just to make sure that they're not too high or too low, but even just to get them out of their shell and comfortable with each other and feel accepted to be part of the group. And like I mentioned, some of them really they stay in touch long after the event. And Vanessa, one of the advocates I mentioned earlier, she loved it so much that she came back to mentor the next round of kids, just to make sure that their experience was the same, if not better, than what she experienced. So all in all, it's a very special event. It's super rewarding, and I would highly recommend it if you're within that age range, of course. Again, next Kids for a Cure will be taking place November of next year, with the applications opening sometime around the summer. So stay tuned. Okay, switching gears, we talked about the federal side, how we advocate for research funding and support through benefits for Canadians living with T1D. On the flip side, for the provincials and territorial governments, we advocate to them as well. And since they are the ones responsible for delivering healthcare, our priorities are a little different there, and we focus more on public health insurance and coverage. Our ongoing Access for All campaign, it aims to make public coverage for T1D devices like insulin pumps, flash and continuous glucose monitors. We aim to make them more affordable, more accessible for those who need it. And since launching in 2019, we have worked with advocates across the country, and we've seen improvements made in every single jurisdiction across the country. This includes introducing coverage in provinces where none existed previously, improving this existing coverage, like removing age restrictions or expanding it to include more brands of insulins or devices in recognition of patient choice. So you'll see here just a few highlights just this past year of some of the improvements we made across the country in places where existing coverage was lacking, or just to expand the age or remove the age restriction there. Moving forward, we will be focusing our efforts in improving existing access in both Ontario and Quebec. And finally, we have an ongoing advocacy campaign you can participate in right now called Advocacy in Action. If you are interested in reaching out to your member of parliament and meeting them to raise T1D awareness and to advocate for supporting the community, I encourage you to sign up by scanning the QR code or following the link, which will be shared shortly. Anyone who signs up will be provided training and resources to help them prepare on what to expect and best practices when talking and engaging with your member of parliament. And that brings us to the end of my presentation. Again, my name is Joey. If you need to reach me about any questions that on the topic we discussed today, or anything advocacy related or government relations related, be sure to send me an email. I'll also go through the chat now at this point because I haven't paid attention at all to go over some questions, but I think Ruth, you'll be fielding some questions too live, right?
Yeah, I think I did address most of the ones that came in through the chat, but Charlene, I don't know if you wanted to unmute yourself and ask any additional follow-up questions or not. And Dale is saying, let me just get the chat open again, sorry. He's asking a question about his Insure in BC stop coverage for his Freestyle Libre CGM, sorry. We do have documents you can download to send to your insurer. Are those still on the website, Joey?
Yeah, that is. If you have trouble finding it, send me an email. I could locate that for you.
Dale, if you wanted to I'm just going to reply to you with the email address, and if you want to send it tomorrow, we can send you that directly by email.
Yeah, I'll do that. Thank you.
Perfect. We have a question. How has Kids for a Cure helped in finding a cure for kids? Have not heard anything about treatment trials for young children. There are clinical trials in Canada that do involve youth. Obviously, any cure-based research would be conducted on adults first before they would do anything that would be done on a young child. But we do have clinical trials that are available for children. We have the TrialNet screening as well. I'll just put in the clinical trials website in here now. And sorry, while I'm doing that, the other question is, hi, what do you think the best way to start advocating for T1D affordable care and access? I would love to meet with Parliament, but I'm a working student, so my schedule is a bit limited. That was Maya. Joy, I'll let you take that while I drop the clinical trials link in the chat.
Yeah, sure thing. And yeah, thanks for the question, Maya. Advocating for T1D affordable care and access. Yes, that's a great question. I can definitely help get you set up with that. We do have the Advocacy and Action campaign that's at the link actually. So if you fill out this form, you'll automatically receive an email from me with some resources on how to best engage with your member of parliament. But we have to be careful there just because if we're talking about access, that's more of a provincial issue that you'll have to discuss with your MLA or MPP. For MPs themselves, we do have some priorities that are more related towards supporting research funding. But in any case, I still encourage you to sign up using that link, just so you can see those resources. You're under no obligation to follow through. If you're interested to learn more, by all means, just fill out the form and you'll get those information sent your way.
I'm just giving Sarah your email address here in the chat. And we're recording right now, so everything will be sent to you tomorrow as well. Linda was just saying in BC, we spent 12 years getting diabetes coverage. It finally worked, but it took a long time. And I remember that from when I first started here 5 years ago. It does. I think advocacy does work, but yeah, the pace is not always as fast as we would like it to be, that's for sure. Melissa, I might ask you if you can unmute yourself just to provide a little bit more detail on what you mean about T1D access and rights, if you don't mind.
Yeah, so my daughter is diagnosed at 4 years old just at this past Christmas time. So we're not quite at a year yet. So we're still learning all the different things. But like just access, like, so we have like a little bag that has all of her like medical supplies and things. And, you know, we have like new swimming lessons. So like going out and saying like, okay, like, can my daughter keep her Dexcom receiver nearby so that I can get the signals and everything to follow on my phone? And it was like a really hard time trying to explain to the lifeguards that she needs to have this to keep her safe. So just any type of information on like what are our rights and how can we best support and communicate what T1D children and adults all need to kind of help their livelihood.
Yeah, thanks for the question, Melissa. Yeah, I could definitely see how that could be concerning, especially if she was just diagnosed. I know this is an issue that we've seen just recently in schools, probably because it's back to school season. But if we're talking about at the pool and with lifeguards, I'll have to do a bit of digging. So leave that with me for now. And if you have any information to share on that, like any details, please feel free to send me that email, or in case you don't hear back from me, send me an email.
Wonderful, thank you. We also had a similar situation at school. We have a new principal this year, and she called saying, you know, like, we're so happy to have your daughter at the school, you know, but we don't have, in Ontario, we don't have like a full-time nurse, so I don't feel comfortable. Like she was saying that she does not feel comfortable having Kendall attend school. Like, but she has the right to go to school like any other child. So just any kind of thing that we can help with that would be great.
Sorry, Joy, I don't mean to interrupt you. Melissa, are you familiar with diabetes at school? I'm just dropping that link in the chat as well. This is an ongoing issue because it differs based on school board and on province. what the rules are around insulin administration, glucagon, bringing snacks, eating. It's not standardized, and it's definitely an issue. Diabetes at School has a lot of resources that are helpful. I just dropped the link in the chat. I don't know if you can see it. Excuse me.
Yeah, I'll definitely take a look. I appreciate it because like even the nursing who comes in to like do her lunchtime insulin, like she's already asking, saying like, hey, can she do this all by herself yet? Because the nurse doesn't feel comfortable doing it. And I was like, but if you're the nurse, like you should feel comfortable being able to do this, not asking my 4-year-old daughter to do it.
No,
Yeah. Sorry, Ruth. Yeah, that's you're 100% correct. That's unfortunately not. We've heard from other parents as well, especially in Ontario. But like Ruth mentioned, it differs from school board to school board, province to province. In Ontario, there is some movement there, and some people I could put you in touch with, and there may be some advocacy opportunities. But again, send me an email and I'll get back to you on that.
I can see that we've got 2 hands up. And looks like Rugia, I hope I pronounced that correctly, was first, and then Neharika. So Rugia, if you want to unmute yourself and ask your question, and then Neharika will go after you.
Yeah, so I have 2 questions. So the first question is there any talk about including the insulin pump or CGM in the National Pharmacare Act? That's the first question. The second question, it actually stems from maybe some of the doubts that I had when meeting with MPs or MP candidates during election season. So they always ask me, what do you want me to do, right? Like when we go to Ottawa, like what are the actions? What should they pay attention to help us? And maybe Joey can expand more about, you know, MP versus MPP and MLA, and uh, what what issues we should talk to an MP, and what issues we should talk to within an MPP.
Yeah, for sure. Thanks so much for the question, Rugia, and thanks so much. I think you participated in Advocacy in Action, or part of that, in reaching out to your candidates during the election. So thank you very much. On your first question about insulin pumps and pharmacare, there is a potential. One thing that the government included in their announcement was that there will be a carve-out for a special devices fund. The problem is there hasn't been much discussion or indication as to what this would look like from the government since they announced it. And it's something that we've asked in the past too, and haven't received a straight answer just yet. But again, if there is some support for insulin pumps and other devices, that would be it within National Pharmacare. So that's something that we're continually pushing and asking some clarity on. On what to ask for from meeting with your MP. On the federal side, if you meet with your MP previously, or initially rather, if you meet with them during the election or just recently as part of Advocacy in Action, our ask here is mainly just so that they are aware that's of the community, in the T1D community in Canada, what life is like living with the disease, the issues that come with it, or the burdens that come with it, the risks involved, and how folks treat it and manage it on a day-to-day basis, just so that they're more in tune and more aware of what that situation is like for the community. With them understanding that, it opens the door for them to do more for us. And a big part of it is, again, building that relationship so that once we do have more concrete ask, which we do in a couple of months, like for instance, whenever there's a budget, whenever they're soliciting recommendations for the upcoming budget, that's when we come in and say, hey, we go back to the folks that we've met with, who have good relationships with us, and we'll ask them to support us and talk about our recommendations with the ministers who have relevant files, like the health minister, finance minister, and so forth. So that is part of the reason why we have these initial conversations and meet with the MPs, even though we don't have anything specific to ask for now at the moment. And going to your question about MPs and MPPs and MLAs. So MPs, they're members of parliament. It's all federal. So you have MPs from across the country, and they represent you on the federal scene. So anything to do with taxes, immigration, and in our case, research. Because like I mentioned, CIHR, that's federal, and they're the main funders for research, or sorry, health research. So those are the issues that we'll be asking for, or asking for support. And going back also, taxation, benefits, things like that. So I mentioned earlier the disability tax credit. Since anyone living with T1D is automatically qualified for the disability tax credit, that opens the door for more benefits, like the Canada Disability Benefit. So that's another thing that we advocate for on the federal side. Provincially, like I mentioned, they are responsible for delivering healthcare. So anything to do with, seeing a doctor or hospitals. But in our case, we're talking about mainly access to devices like insulin pumps and CGM. So in some provinces and territories, they may have restrictions as to, okay, you have to be this old to receive a publicly covered insulin pump, or coverage cuts off at this age. So that's something we're trying to eliminate, because anyone who needs it should be able to access it. And to your questions about MLAs and MPPs, that they're just, depending on which province you're from, they're named differently in some cases. Like here in Ontario, they're all called MPPs. That's just the main difference.
Thank you.
Niharika, and I apologize if I mispronounced your name, if you wanted to unmute yourself to ask your question.
Hi, am I audible?
Yeah, we can hear you. Go ahead.
Okay, perfect. Thank you so much for the presentation. I have I have two parts to the question. So I 100% agree that yes, the treatments should first happen in adults, and then once the safety is ensured, then it should flow down to maybe the next age group, and so on and so forth. I guess my question is more on the technicalities of it. So when we say that the safety has to be measured on adults, is there some sort of a timeline where the safety is being measured? And the reason I ask is because our human bodies are funny, right? Because you never know when something would hit, and if it is in direct relation to the cure that has been given to you, or totally something non-related. So what is the protocol around measuring the safety net, and then moving on to the next set of human beings who are being treated in clinical trials and their safety? And the reason I ask this question is because there's so much available for managing T1D that I really fail to understand what is the sense of urgency and what is the incentive that is pressing enough to sort of have a functional cure being made available to all the individuals, right? And people have told me that I was 5 years old when I was diagnosed, and they said, just wait 5 years and you'll have a cure. And the person is 70 years old, right? You know what I mean? So I'm just trying to understand the process of, do we have all the time available, or is there a protocol around it? Sorry for the rant. I just wanted to make sure that people understand my question.
I will say, this is definitely outside of Joey's wheelhouse. He would not be within the weeds and details clinical trials. I think I remember you were part of our clinical trials event that we did in March, and I know we spoke a little bit about this then. And I appreciate the frustration. There's actually somebody on this call who's been living with T1D for over 70 years. He comes to many of our events. And so I know that most people, when they were diagnosed, were told that the cure is 5 years away, and it doesn't matter if that was 50 years ago or 5 years ago. In terms of what is Breakthrough T1D going to be doing about stem cell and ensuring that it gets to the market, that's something, and I can send you a link that's from our headquarters, which is the US affiliate that lays out their roadmap. And there's something called Project ACT, which is about bringing stem cell therapy from the lab to the market. But the cure in and of itself, and screening and prevention, which I know I put the trial net in the chat as well, is not there yet. But once it is there, that roadmap that's being developed in the US and part of Project ACT is what would be used to ensure that it goes from the lab to the people who need it. I know that's not a satisfying answer because you want your child to be cured yesterday, but that's the only answer at this point that I can give. But I'll put that in the chat. Unfortunately, in terms of clinical trials and the protocols and regulations, that's beyond Joey's purview, so he wouldn't be able to answer that.
And that's okay. And the reason I asked is because they're being funded and the government is funding them out of the taxpayers' money, right? So I wear a different hat as well. So for me, stewardship of the money for the purpose it is being invested for, and having clear-cut guidelines of how this is being expended and what are the results, because there's plethora of time, like there's no urgency. While I think, I wanted my child to be cured yesterday, and so are some of the other parents, I clearly don't want my child to be 30, and still waiting for a cure. I'm like clearly not saying 70s. So, I mean, I genuinely wish there was some sort of, how when the pandemic hit, right, we had something on the table, not in that sense, but you know what I mean? Like, there is a sense of urgency. But I don't know how I can best express it. I just feel that we're just waiting here in the hope that one day we'll find, right? As long as it's not a false hope, I'm okay with that. But I don't know.
I mean, the only thing that I can say is that the urgency is there. This science is just slow. But the 70% of Breakthrough T1D Canada funding for research goes to cure-based research. The other 30% is improving lives, which is things like devices and better devices and our mental health program. But the other 70% does go to cure-based research.
Right. Okay. And just keep in mind, if you can just send me anything to that effect, which clarifies and kind of holds the people accountable for that, I would be really happy to know that. Thank you.
Okay. Email me and I'll send you some stuff tomorrow as well. Did we have
Awesome.
any other questions? Felicia, did you want to unmute yourself?
Yes, hi. I'm a type 1 diabetic living in Quebec. I was just, I'm very new to this advocacy thing, and I'd like to get involved. When we say that we can fill out the form and we'll get the training, is that something that we're going to get on a province level as well? Because I know that, for instance, Quebec is very different from Ontario and other provinces. The issues may or may not be the same. So when we get this training, will it be something that I can speak provincially as well as federally?
Great question, Felicia. Unfortunately, the training themselves, most of it is geared towards federal members of parliaments. That being said, a lot of the best practices on how to engage and where to find them, I think that sort of translates. But at the same time, if we're talking about Quebec specific, we do recognize that there's a big gap there in terms of coverage, and that's something that we've been frustratingly working on for the past year or so. We might have an opportunity there. We might have advocacy opportunities there for people to participate within the next couple of months. That campaign is still being fleshed out. So in the meantime, I'll make note of your name here on my notes, but also provide a link as to how to sign up to become an advocate so that when these opportunities do come up, you'll get notified right away. So give me a second and I'll drop a link in the chat.
Yes, I'd love to. I know that Quebec is very different as well, so I don't want to take up too much of people's time, but I do know that it's extremely important in this province to, act up and talk about it. And if ever there's some issues in French, like I'm bilingual, I'm not a translator or anything, but I did notice that was something when we sent the letters, to our I'm sorry, I didn't catch all the acronyms, but MPs or whatever it was, there wasn't a letter in French. So if there's something that I can do to help, whether it's like roughly translating or something Quebec specific, like I would love to give my name for that.
That's amazing, Felicia. Thank you so much. And yeah, we do anticipate there being an opportunity, especially with the election there just around the corner. It's a very good opportunity to engage not just with the government, but also with the opposition. So one of our goals there, as you may know, insulin pumps is very restrictive. So we're trying to get a commitment for them to remove age restrictions altogether, written confirmations and within their party platforms. So yeah, that's something we're working towards in the next couple of months. So please stay tuned.
100% agree with that.
I'm just going to post in the chat as well for both of you and Maya the letter to the editor that we sent out to Quebec media earlier this year, asking for the removal of the age restriction on pumps in Quebec. So as Joey mentioned, it's something that that team has been working on for well over a year. I would say 2 years, I think. And I know probably ramping up again in advance of the next provincial election. So I don't know if you saw that Maya was also interested in volunteering, and she's in Quebec as well. So thank you to you both. We have a few minutes left for any last questions, if anyone had any, before we wrap up for the evening. Okay, well, thank you everyone for participating tonight. And I was going to say, if we didn't get your question, or you think of something tomorrow, just please send us an email. We'll do our best to answer it. I want to thank Joey for his time tonight. Oh, I just see Linda popped a question quickly. What can we use to state how important pumps are? I've been on a pump for 20 years and no 911 calls made before. Yeah.
If we're talking about improving coverage, definitely talk and reach out to your local representative to get that conversation started, and to make sure that they're on your side and that they in turn will advocate for you within the legislature. I think that's the best bet. But if you have any questions on that, again, shoot me an email.
I see there's someone with their hand up. I don't know if you raised that on purpose or not. But if you wanted to get your question in quickly, you can just unmute yourself.
Hello.
Hello.
Hi. I was just wondering, where can we find a current list of all diabetes-related meds that are covered by pharmacare?
If we're talking about just the one in BC pharmacare, that's different than the national pharmacare. But in any case, just send me an email and I could send those links over to you and get you that list.
I also just put in the chat the coverage map.
Oh,
that's got the different that's got the different coverages by province broken down in that map. But you can also email Joey. He can send you province specific information tomorrow too. So I think we will wrap this evening up. And Joey, thank you so much for your time and your expertise. And also want to mention that we have support from Insulet and Abbott to help us put on these events. So thank you to both of them as well. We'll be doing T1D in your finances in October. So that's information on the disability tax credit, the Canada Disability Benefit, the Registered Disability Savings Plan, and how your family might be able to benefit from that. So we hope that you can join. And then in November, we're going to be having a clinician joining us to talk about the clinical practice guidelines, automated insulin delivery systems, adjunct therapies like GLP-1s, and just how different devices might work for you. So hopefully you'll be able to join us for those. And if you're in Toronto, we're having an incredible storm right now. So everybody is home safely. It is like a horror show outside. I don't know if you can hear it through my computer, but everyone, please stay safe tonight wherever you are. And thank you so much for joining again. Oh, October is October 28th and November is November 19th. We'll have the October event up on our website tomorrow. And do you have any other last words, Joey?
No, other than thank you so much for sticking around till the very end. And again, if you need to reach me, my email's there in the chats. And again, thanks so much and hope you all have a great evening.
Thanks so much, everyone.
Take care.